So, how does it work with, because you touched on second opinions a little bit, how does it work when you're a second opinion and in terms of your interaction with the other doctor that's the primary medical oncologist for that patient? Like what does that look like?
So medical oncologists work together all the time. And it's interesting because it's probably different in surgical oncology or radiation oncology because you're not going to get two surgeries. You're not going to, or at least, not the same surgery twice probably. Whereas you can kind of split your care with medical oncology across a few different places. And the relationship with a medical oncologist is usually very, very positive, particularly now. I mean, people are more mobile than they were, I'm sure, ever before. So the circumstance in which someone gets a second opinion or wants to transfer care is really common. It's pretty standard. It's pretty normal. I'll say when people get second opinions, if you're curious about something as a provider, if I'm like, they were offering a therapy, I wouldn't really have done that. I think a lot of times we'll just talk to each other. And it's easy to play Monday morning quarterback from someone else's care plan if you have more information, or if you're lacking vital information that they had. It's really easy to say, "Oh, that's crazy," and then you talk to them, and you, okay, well, I guess that wasn't that crazy, knowing these details. So I think by and large, medical oncologists work together really, really well. It's more often than not when barriers are in place, it's institutional barriers. Like it's hard to get scans. It's hard to get information from one institution to the other. Pathology slides don't get transferred in a timely fashion. So care can break down because of logistical barriers, but it's not usually at the individual level.
That's good to know because I think there's a big misconception that you will really annoy or irritate your primary medical oncologist if you get a second opinion.
It's funny. I had Dr. Ben Fangman, one of my co-fellows. We had to talk about community versus academic oncology, and I share his perspective that if your oncologist is upset that you got a second opinion about your own cancer care, then maybe you should consider a different oncologist. We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.